What's up, everyone? Happy Saturday. I know I haven't made a video in a while, so I thought I would make one kind of check in, let some people know how my training's going, as well as I kind of want to talk about some myths around type 2 diabetes or misconceptions. So, first of all, my training is actually going surprisingly well. My injury that I ended up rehabbing with my foot is rehabbed and healed nicely, and today, before I'm making this video, I actually ran a half a marathon, just 13.1, well 13.2, which went really well. My pace was, I was very surprised at, so that was really a confidence booster, because going into the run I was pretty nervous, and this right now I think it's 71 days about until the race, and I'm getting pretty nervous because now in my training and starting to get into the mileage that I've never gone in before. Today was the farthest I've ever run, and next week I'm running 14. The week after I'm running 15 miles in terms of my one long run, and I'm pretty nervous just because I've never done this before, and that's a lot of miles to do at once, and since I've already been injured, I'm very cautious about that, and so. But today my pace went really well. My breathing, it was a gorgeous morning. It's a gorgeous morning right now here in St. Louis. The weather's been really hot and humid, so today it's about in the low 70s, and that went well. So I'm really happy about that. So everyone who, in terms of helping me with my training and their advice, what they've done with this kind of injury and everything like that, that's been a huge help moving forward. So excited to face those challenges with my training coming in the future. But like I said, I also wanted to talk about some things about type 2 diabetes. And obviously I'm a type 1 diabetic, but that statistic that I said a couple of weeks ago, or my very first video, that 1 in 3 people will be diagnosed as a diabetic in 25, 30 years. That's a scary statistic. Now, most of those people who will be diabetic and who aren't diabetic right now are technically type 2 diabetic. Not technically, they are type 2 diabetic. Now, a big thing is there's this big judgment with type 2 diabetes that it's the fat disease. Well, that's a really harsh way and a really inaccurate way of looking at type 2 diabetes. Now, type 1 and 2, some even said they shouldn't even be called both diabetes, just because how it happens is so different. But the result is somewhat similar in that you can't control your blood sugar. And with a type 2 diabetic, yes, when you're overweight and going up those scale and your BMI continues to increase, not only are you at risk for type 2 diabetes, but cardiovascular disease and all these other things. Well, type 2 diabetes and diabetes in general is a metabolic disorder. Specifically with type 2, there is some reason why that the receptors aren't recognizing insulin. Now, I've read a lot and I'm learning a lot about the inflammation that happens and possible causes of what can decrease your sensitivity to insulin and increase your resistance. And it has a lot to do with yes, genetics are a huge factor, but the lifestyle is probably the biggest factor, and what you put in your body and how much you exercise as well. In this country, we eat way too much starch, way too many refined sugars, and sugar in general, and that creates a whole inflammation cascade that makes it so hard for your body to just use those insulin receptors, which causes eventually type 2 diabetes and decreases your sensitivity. Now, I also wanted to bring this up because if somebody is type 2 diabetic, and obviously their lifestyle, their weight are factors, but just because they're fat, or that sounds even rude of me saying, but just because they're overweight doesn't mean that they're diabetic. That's not the correlation. The correlation is what they're putting in their body, and just because it's unfair to label type 2 diabetes as the fat disease. And I also wanted to make this video because a couple people have talked to me about a documentary on Netflix called What the Health, and that is I watched most of that documentary, but its big thing was that processed meats are a huge carcinogen and cause cancer and diabetes and all this other stuff. And there's some things with that film that I agree with, but in general, when you watch a documentary, it's important to take a huge grain of salt. That documentary and a bunch of others that I've seen don't present the same amount of information of different sides of the argument similarly. And so I would agree that we should probably cut back on all the processed foods that we eat as much as possible. That's something that I'm working on doing myself. But the most important thing from everything I've learned so far and lived throughout my life is the amount of starch and refined carbs and sugar will have the most immediate impact on your insulin sensitivity. And that is for sure what you should focus on, in my opinion, right now. Focus on first. With type 2 diabetes, pre-diabetic, even type 1 diabetes, I've seen it change my insulin sensitivity. I've had to give myself less insulin based on the foods I eat for a long period of time. So, and that's partly why I'm doing this. Just because you're diagnosed as a type 2 diabetic or a pre-diabetic or a type 1 diabetic, that label of a disease doesn't necessarily define you and limit you, and anything is you can be in control of your health. You can be in control of what happens, and so even I'm type 1 diabetic, and I feel very strongly and connected to others that are and that I've met so far. I recognize that most people in my future office that I'll be working with will be type 2 diabetic, and that this is a huge problem, and I have huge empathy for those people, because it is something that I want to help others get better at and defeat and change their insulin sensitivity. Anyways, I've probably rambled on long enough, but anyways, if anyone who's watching feels so inclined to donate to my cause, I'm attempting to raise $1,500 for the American Diabetes Association, and the major government fund for diabetes research, and as well as not just research, but just modes and mechanisms of how to better control your life and technology with diabetes. So if you feel so inclined to do so, I'll have a link attached to this video, and appreciate any amount that you guys are willing to give. And everyone who's already given, thank you to the bottom of my heart. It means so much that I've raised this much already. And for anyone who's supported me just with accomplishing the goal of the 26.2, I appreciate it too. So anyways, thanks guys, have a good weekend and kick ass this week. All right.